So we're going to move now on to analysis considerations, and delighted to welcome Chris Robertson. So as I think many colleagues will know, this is one of really the first times that comparable data sets are have been made available across different jurisdictions. That's been a fabulous opportunity, but also posed a number of analytical challenges. And it's been a privilege to have Chris really driving thinking in that respect. Chris, over to you, please.
Okay, thanks, Aziz. Could you move on to the next slide, please? So this is just a recap of the initial studies that Aziz shared with you at the beginning of the presentation. I expanded the children and young people to look at schools, but these are the main areas that we were looking at. And the next slide, please. So for the children and young people vaccine uptake study, what we were trying to do was to look at the rate of uptake of the first and second dose in different age groups of children, primary school, early secondary school, and later secondary school. And we were trying to characterize how the rates of uptake changed with socio-demographic groups and clinical characteristics of these children, as well as by age group. So that was our research question for that particular project, but for the other projects, there was something similar as well. So next slide, please. So the way that we worked together was a twofold approach. So what we have is in the 4 centres in the UK, we've got analysts who are working on their own sets of data. So as we start on the analysis to pool the results together, what we do is we set up, first of all, a statistical analysis plan, and that's the head is the one developed by Sarah Aldridge in Wales, but with analysts in the different centres there, looking at how we were going to do this analysis. And these statistical analysis plans are published and are available freely once we've done the work. And the second way that we work is through using a relatively up-to-date flexible working processes, in this case using Microsoft Teams, which are hosted at the Edinburgh University websites, and all of the analysts and people working on the projects can access the same documents and edit them and keep them up to date there. So that's how we're working in different areas with shared documents and a common statistical analysis plan. The next slide, please. And the main thing we're trying to do is through our planning, we're doing exactly the same analysis in each of the centre. The way we do that is we develop the statistical code in one of the centres, and in this case, it was Wales that developed the code for the vaccine uptake in children, and then we share our computer code with the other centres who, by using it, validate it and reuse it. What we then do is get a summary of the results, and these are then shared and combined in one of the centres. And in that way, the original individual level data, which you've heard about from our colleagues, never ever leaves the home trusted safe haven. And all that's shared is summary tables, which are put into the publications, or summary estimates from statistical analyses. Next slide, please. The other main way of making sure that we're doing exactly the same work is that there are regular video meetings with the analysts, sometimes up to 2 to 3 times a week when they're coming to the end of finalising the study. And the main challenges that the analysts face is being extremely careful about the exact definition of the variables. And for something like age group, it's easy to say, well, we're going 5 to 11 and 12 to 15. But then the question is, at what date are we looking at the age of the child? So it becomes very, very particular about the definitions. And then when you're talking, you may say 5 to 11, but does that include 11 or does it not include 11? So very, very detailed discussions about the exact definition of all the variables. And once that's ironed out, usually through these short meetings that happen regularly, and the tables are all ready, then the next thing is to share the data. And the main issues then arise is when we're sharing data with small counts. And we overcome that by sometimes regrouping and also by having missing data in the shared tables, which we then aggregate together to publish the unified data for the United Kingdom. Okay, thank you. I think that's all my slides.
Thanks very much, Chris, and thanks so much for your kind of leadership in this respect. So I think between us, we have now been able to run studies on up to 30 million people across these 4 data infrastructures, which are some of the kind of biggest analyses ever run in the UK. And this group is currently running, working on an analysis for the UK's first 67 million study. So I think fantastic progress, really important outputs.